Hi, I'm Melissa, a nurse injector at Cynthia Gregg, MD, Face and Body Specialist, and welcome to our Patient Appreciation Day. We appreciate our loyal clients, and to new clients, welcome. Today's topic, I'm going to be covering how to reduce the skin under your chin. And this question comes up very often amongst patients, especially as we start to age. We'll start to get a little bit of skin laxity under the chin, and oftentimes patients wonder, what can I do for that tissue? And so I'm going to explain why we have the skin under our chin and what things you can do, what modalities we have to treat that. So the human face ages very predictably. As we age, we start to lose volume, and I'm going to show a picture of the triangle of youth, where in youth we have these fat pads and this, our bone is not reabsorbed yet and everything's kind of all together and taut. But as we age, we start to lose fat and we start to have fat atrophy. And what happens is the loss of fat, the loss of skin laxity, which is elastin and collagen, and bone reabsorption is another component of aging. All of those things combined contribute to the aging face. And what happens is it will drop back to the jawline, the tissue and the skin, and it will fall under what we call the segmentum or the chin. So this skin exists because of aging products of the human face. So the question is, well then, how do we remedy it? So it really is going to be based on your face, and it's going to be based on what your provider tells you. There's genetic variables and other things that we have to take into consideration. But usually what we want to do is we want to address any structural changes that have occurred with dermal filler. And what we do as injectors is filler is not meant to look full or puffy or strange. Filler is meant to enhance, hydrate, and also supplement these structures of our face that we've lost over time. So for example, maybe a patient would come in with just a little bit of chin skin. And I would look at her and say, okay, it looks like you've got a little bit of fat loss here in your cheek area. And it looks like your jawline's got a little bit of volume loss from bone reabsorption. So maybe we would inject 1 syringe of dermal filler, which is about 1/5 of a teaspoon. It's hyaluronic acid gel, and I would just kind of supplement the structure of her cheek bed and look contoured. And then maybe 1 syringe to the back of the jawline. And what that does is I'm replacing structure. I'm replacing what she already had. And by doing so, this chin skin is now redraped. So that's one way of addressing chin skin. Now, everybody's face is different. Some people have always had chin skin. Sometimes from puberty on, it's a genetic component, or maybe we have a recessed chin. Our bone structure has recession. In those cases, your provider could inject dermal filler on the chin area right above the bone and give it a little bit of projection and thereby redraping the chin skin. So a lot of chin skin starts with structure. And that's where that diagram nicely shows the human face and kind of what we do here at Dr. Gregg's office to ensure that we keep those little building blocks where they need to be, or we supplement the blocks with a hyaluronic acid dermal filler. Now, there's other things that we can do, but you'd want to talk to your provider about what filler is best for you. There's many, but I won't cover them all today. But essentially just addressing your volume loss. So the other thing that contributes to chin skin or excess chin skin has to do with muscles of the neck. Some people will use their neck band muscles, they're called platysmal bands, and they'll use the muscles, and over time the muscles will get strong. And when they get strong, they'll actually pull down on our chin skin. They depress or they pull. So again, this is where you have to have a really good provider to look at you and determine if you're a good candidate. But sometimes simply by injecting Botox in the neck bands, a very safe injection, almost painless, it takes less than 5 minutes, can release or atrophy the neck bands that are pulling on your chin skin and thereby lifting it. So that's another thing. Botox into the neck bands can help with chin skin if you're in fact using them. I find a lot of my patients who lift weights will pull down and start to exacerbate these neck bands and thereby exacerbate their chin skin. So again, getting assessed for if you're a good candidate for Botox. The other thing is you want to look and see if, we will see if you have excess subcutaneous fat, so excess fat. And sometimes patients may be a candidate for something called Kyella. And Kyella is, it's deoxycholic acid that's naturally occurring in the body. And what it does is it simply goes into the fat and it dissolves it. But not everybody is a good candidate for that treatment, and that's why your provider can sit and discuss if you are. If you were, you would get an injection that would reduce the fat under the chin and thereby reduce your chin skin. The last modality to kind of rejuvenate the chin skin, and I shouldn't say last, one of the last two, is going to be to tighten up the tissue. So we lose foundation, which we've talked about, bone, fat, and all of that, putting that back with dermal filler. We may use our neck bands, and we talked about Botox, but the other component is just loss of elasticity and collagen. It's inevitable. We are going to lose collagen every year. I believe it's 1% a year of collagen that we're losing. So what are we doing to activate collagen? What are we doing to stimulate collagen? Chin skin is also skin laxity. Now, it's not skin laxity alone, but there's many modalities of how we can tighten the tissue. First, medical grade skincare. See an esthetician, get a consult, and start on products that work for you. Not everybody's the same, but it's really important to use the right things. It doesn't necessarily have to be fancy, it just has to be right for your tissue. Second, we have microneedling, which is a service that is offered by our estheticians that will help kind of strengthen the top layer of the tissue. That's a great treatment for getting the chin skin to start looking better. The other modality is called soft wave or all therapy, and that's using heat to generate collagen production. So what we do as providers is we'll look at your skin and we'll determine if you're a soft wave candidate or if you're an all therapy candidate. And then we will go ahead and provide heat to cause the collagen to stimulate. And that is a great way of kind of reversing the collagen loss, but also kind of putting collagen in your collagen bank. So we offer that here as well. So that wraps it up for how to reduce chin skin. And if you have questions, please email us at injectablequestions@cynthiagregmd.com. And we appreciate you very much. Thank you for attending our Patient Appreciation Day virtually. And we're here if you need anything.